It's good to see everyone again. Thank you, Chef AJ, for allowing us to be part of this wonderful year in all things autoimmune diseases and being able to tackle some of the hardest challenges in diagnoses. Plant-based eating is the way to go. It's how Dr. Yu and I have really transformed our health. And we live differently, and there is hope, and we practice very uniquely in Orange County. So we'll talk about our topic, and today we're talking about postural orthostatic tachycardia syndrome. It's not POTS in your kitchen, but POTS a diagnosis.
And I'm Dr. Micah Yu, and this is Dr. Melissa Modala, and we're going to say that we have no medical disclosure here. This is only for educational purposes only. A little background on me first. I am triple board certified in internal medicine, rheumatology, and lifestyle medicine. I'm also a graduate of the University of Arizona's Andrew Weil Integrative Medicine Fellowship, and I'm also certified in functional medicine through the Institute of Functional Medicine. And I am the co-founder of Dr. Lifestyle Clinic, which is our clinic here in Newport Beach where we practice integrative medicine. And next, Dr. Modala will present her background.
Yeah, so it's so good to be here, friends. You probably know I'm a family and lifestyle doctor, double board certified, and I really have a passion for psychiatry. So I was a psychology major and then went back for more fellowships. So that not only in lifestyle medicine, but psychiatry and integrative psychiatry. And I got a certificate at UCI for health and wellness coaching. And I definitely am passionate about all things medicine and lifestyle. So I combine both of those at Dr. Lifestyle Clinic, and I'm a former board member at the ACLM.
And this is our social media. You can find me on Instagram, YouTube, TikTok, Facebook at My Autoimmune MD. And my website is myautoimmunemd.com. And Dr. Melissa, her handle is Dr. Melissa's Kitchen on social media as well. And her website is melissamodala.md.com. If you want to make a clinic appointment with us, please go to our website, drlifestyle.org. You can call our assistant there, or you can make your own registration and appointment there as well. So we have a couple of objectives here. There's 6 of them. I'm going to do half, and Dr. Modala here is going to do the other half. So we're going to start with the definition, then talk about a little bit about the history of the syndrome, then talk about the background of POTS, some testing, diagnosis, and then potential treatments. So, Dr. Modala, you want to start off with talking about POTS?
Yeah, so as I said, in our clinic, we see a whole host of different conditions. Sometimes they can be mysteries. Sometimes it's hard to define. And one of them is POTS. POTS is actually pretty common in terms of there's somebody you may know who has high heart rate. So the tachycardia in POTS, it means high heart rate. But I would say it's 500,000 to almost 1 million people with a prevalence about 0.2%. So we often see in the medical textbooks that it affects females. 8% of females will get it, their first symptoms in their teenage years, 15 to 25. However, we've seen a whole host of different types of patients who get it. It can be males, it can be older, I would say 60s, and there's really no age limit to POTS because we always look at the underlying causes, and it's not that simple. So the definition of POTS is basically when there's an intolerance, we call it orthostatic intolerance, because it's when you change position from usually laying down to sitting up or laying down to standing up, and these are quick maneuvers. And it's more than just vertigo or the world that is spinning around you, that sensation that you're on a roller coaster or you're dizzy. It's actually when the heart rate jumps really high, and you tend to see it when it's just the heart rate going up. It's not necessarily what we call orthostatic hypotension, which is usually when the blood pressure drops, when we see that in the systolic, that top number. And when that happens, you have reflexive tachycardia. So that means you need both for orthostatic hypotension, a change in blood pressure, about a drop in 20, and then an increase in heart rate. But POTS is just an increase of heart rate. And you see this typically because of a nervous system dysfunction. The autonomic means it's a unconscious nervous system response where you cannot necessarily consciously control that. And that's where a lot of people get anxiety, or a lot of patients wonder why their heart rate is feeling like that when they feel okay. And I would say it's really this homeostatic control that is malfunctioning. So let's talk about the history of POTS. As I mentioned before, this is one of those unique diagnoses, and it was first found in medical literature as far back in the 1871. So Dick Hosta coined it as irritable heart. So if anyone has had this sensation, it really feels like you're almost not only having palpitations, but it feels like you're maybe having a heart attack. It's uncomfortable. You may get confused because it's just in a sense your body may even feel like it's lightheaded, or you're having maybe even dizziness. So back in the day, they found it first in intestinal infection. So that's GI bugs, either bacterial or viral. And after they've had some type of infection in soldiers during the American Civil War. And then they saw it again in 1920s in Sweden. Blur and Laurel actually termed it when the heart rate elevates when standing, but also we call it deconditioning. Likely deconditioning means when they haven't been really mobile, exercising, moving, they were maybe dehydrated, and they found it in young women. They called it back then arterial orthostatic anemia. So they got it sometimes confused with anemia because the symptoms can be almost similar to anemia. But it's really this arterial orthostatic response. So that's your circulatory system. And then similar cases in young women occurred through the years, but it wasn't until the 1993 when they termed it POTS. And so in Mayo Clinic, Scarforth and Lowe, they identified it as just sudden onset. It's unpredictable, and it's something that they couldn't even find out the root cause of it, and that's why it's called idiopathic. And it's pan-dysautonomia, and they attribute it because of this hyperadrenic. So it's basically the fight or flight sensation that the body is hyperactive, and it just fires the alarms, and that's why the heart rate goes up. And there's this abnormal orthostatic heart rate acceleration. So Dr. Yu will describe this more, but typically, we see more of the research leaning towards a triad of diseases that overlap in symptoms. So that's going to be the hypermobile Ehlers-Danlos syndrome, the mast cell activation syndrome, which we've talked about in a previous I would say talk. So go back to that if you are wondering what that looks like. And that's usually more of this allergic response with rashes and itchy eyes. And then all of this can really overlap in symptoms, but really POTS alone requires more and more investigation and research to really understand the disease.
All right, so I'm going to be talking about the pathophysiology of POTS, the signs and symptoms. So the pathophysiology of POTS, there are different theories behind how POTS occurs. So part of it is from our nervous system, and the other half of it is from our circulatory system. So we understand that the nervous system is involved with POTS, and it's dysfunction of the nervous system, autonomic nervous system, that causes POTS, that causes the spike in heart rate to go up, and the dizziness and the brain fog and the fatigue to happen. And patients in POTS, they have a hyperadrenergic state, meaning their sympathetic nervous system is fairly high. And the symptoms of POTS include fast heart rates. Sometimes patients might faint, or they're about to faint. Tremors. There can be nausea, vomiting, anxiety. So patients could be misdiagnosed as having just anxiety, and no one would ever look as to the reason why they have anxiety, and that could be due to POTS. And mental clouding is brain fog. Patients can seem to have low capacity to memorize things, can forget where the keys are very easily, stuff like that. So that's mental clouding. Let's talk about the diagnosis here. So the diagnosis of POTS is Dr. Modala will go over that.
And yeah, so as you can see on the right, there's different definitions by different societies. That there are neurologists, the cardiologists, and different, I would say, parts of the world. But overall, the common symptoms, as Dr. Yu has described, is really this lightheadedness, the palpitation. So we really ask a detailed history from head to toe and investigate, has there been blurry vision? Sometimes people have exercise intolerance. And I've had a patient who was very, very active, a jiu-jitsu person who just loved it. That was his main sport, could go 5 times a week. But after COVID, he actually started to basically decondition, not be able to handle exercise, only 5 minutes of it. And he would break out in tremors, palpitations, sweat, and also palpitations to the point where he would almost feel like he was having a heart attack. And so that fatigue would last not just days, but for months for some people. And so that's why we often see these symptoms go undiagnosed or untreated, because it is definitely something that you need to pay a close attention to, but also ask a series of questions. And then another thing is to actually perform tests. You can do a simple one at home or guided by a medical professional by seeing if there's an increase of 30 beats per minute in the heart rate when laying down to standing, and it's supposed to last more than 30 seconds. Sometimes it's greater than 40 beats per minute in those who are teenagers, because 12 to 19 years old, because they tend to have higher heart rates at baseline. And once again, as I noted before, they don't have a change in their blood pressure where it drops greater than 20. Back in the day, they actually used something called tilt table test. There are some academic cardiology institutions that still have this, where they are upside down. It almost looks like you're at the gym and you are trying to simulate this response. And it's not an inner ear problem that most doctors may get confused of, but it's really a circulatory response when they notice the jump in heart rate. And often we always say, let's check your blood work. We want to make sure it's not anemia or some type of hyperthyroidism or other imbalance. And then we look at autonomic function tests. So what does that mean? That means basically, a lot of my patients do this when it's cold outside, or they get out of the shower, or they jump into a hot tub. They get a sensation that they're almost going to faint, and they can barely catch their breath. So they have a hard time because not only their heart rate is beating fast, but it's hard for them to take that deep breath, and they often almost pass out. And
so I'm going to talk about the clinical presentation here. What? Oh, our dog's here.
He's joining us.
Let's go.
His name's Cookie.
All right. So let's talk about the symptoms of POTS here. So that includes fatigue. I have patients that are very tired all the time from POTS. Their heart rate is very fast. They can sometimes pass out when they're standing too long, or they can pass out just from standing up from a lying position. And brain fog is very, very common, along with headaches. That is not something that's out of the ordinary. And we talk about fast heart rates already. Nausea, vomiting can happen. Patients, I tell them they should exercise, but unfortunately, because of their POTS, they have difficulty exercising. They can't tolerate certain exercises. Even taking some walks can really tire them out. There are specific exercises that they should be doing, like exercise on a recumbent bike. There are physiotherapists out there that understand POTS that can help these patients. Also, patients can get worse in hot environments. I have a lot of patients that tell me they can't tolerate heat at all. It's called heat intolerance. That happens a lot. And patients, they need to take a lot of fluid and salt, sometimes 8 to 12 grams of salt a day, just to keep their their POTS under control because they're constantly volume depleted. So it's really important that we understand how to approach POTS and how to manage the symptoms, because yes, a whole food plant-based diet is very helpful. I believe that low salt, low oil, low sugar diet is very helpful as well. But in these patients, they need a lot of salt, unfortunately, to get better. And let's talk about the differential diagnosis here. So POTS, there are different diagnoses that can mimic POTS, such as orthostatic hypotension. So patients with orthostatic hypotension, they do stand up and get dizzy as well, but the blood pressure drops in orthostatic hypotension. In POTS, it should not drop that much. And there are two other diagnoses that I think of as a physician when I see a patient with POTS. I think of Ehlers-Danlos syndrome and I think of mast cell activation syndrome. Ehlers-Danlos syndrome are patients who have connective tissue disorder, where their skin is hyperflexible. They're very bendy. They're very hypermobile, hyperflexible. They can twist and turn their fingers and arms in ways that are not expected of a person. So patients with Ehlers-Danlos syndrome also, they have excessive bleeding of the gums sometimes and a lot of nosebleeds. So that's Ehlers-Danlos. The other one is called mast cell activation syndrome. Mast cell activation syndrome patients have a hyper active allergic system. So the mast cells are gone crazy. So these patients, they can have a lot of sinus issues, a lot of congestion, allergies all the time. They can have diarrhea, abdominal pain right after eating, or even eating overlap food can cause issues. High histamine foods cause issues. Chocolate, wine, certain foods like citrus fruits, avocado can cause issues for these patients as well. And different autoimmune diseases can contribute to POTS. Sjogren's syndrome is one of the top 3 autoimmune diseases that causes POTS. Lupus can do it, Lyme disease can do it, and also diabetes. You might be surprised. How does diabetes relate to POTS? Well, diabetes affects the nervous system. And when that happens, it can cause a disruption and cause dysautonomia, which is what POTS is. POTS is in the spectrum of dysautonomia. And one very important diagnosis that you need to be aware of is COVID-19. COVID-19, as you know, can cause long-haul COVID. And long-haul COVID has been associated with POTS as well as mast cell activation syndrome. So you need to be aware of it. If you have had COVID and you start getting a fast heart rate and a lot of allergic issues that no doctor has been able to help you with or give a diagnosis to, you got to think about these two. It's very common now. And let's talk about the potential treatments. So potential treatments, I talked about water and salt intake already. You need 8 to 12 grams of salt intake and at least 3 liters of water. That's really important. And exercise regimen is really important as well. Finding a really good physical therapist in your area or online that can understand how to treat POTS. And lifestyle treatment is very important. So Dr. Melissa is a lifestyle expert here. So I'm going to leave it for her to finish this last part on lifestyle management.
Yes, so thank you. And I would say that, let's go back to increasing water and salt intake, because literally when someone is having a high heart rate in the hospital because of infection, what we do, we give water. We also give it with NaCl, that's normal saline at times. And that's how our arteries and veins can basically not only stay hydrated, but come to a healthy blood pressure, because sometimes people drop their blood pressure and get septic. So I would say there's always a role for both water and salt. And sometimes people are afraid because salt, are they going to swell up? This is not a case for patients who will swell up. This is actually needed to bring back the water back into their arteries and be pushed to the heart. And the reason why that's important is because when we talk about lifestyle changes and exercising, when you go to your physical therapist or when you are trying to we put more, I would say, blood towards the heart, we call that cardiac output. You want to be able to do more squats, and that's squats and leg crossing and shifting the weight in certain directions can have more blood flow to your heart, to your brain, so you feel less lightheaded, and you don't have this numbness and tingling in your hands or feel extra cold. So that's why there's a good balance of salt and water. And then exercise, as Dr. Yu mentioned, the reason why that's important is because sometimes people want to jump in and exercise, because exercise, yes, is medicine, but there's a place and a role for that. When you're going through POTS, it can be very unsafe to go back to your usual exercise without being cleared by a physician or a cardiologist, because you can risk not only passing out, but injuries, and you might have a fear or anxiety about exercise. So it's always good to just get the blessing and approval of going back and doing it gradually. So position does matter when we talk about lifestyle management. So the best way to avoid symptoms is just sitting upright. Sometimes people have the temptation to want to lay down all the time, to take naps because they don't feel well. But if you're able to avoid laying down constantly and taking naps, you're able to improve your quality of sleep. And then once again, what activates the hyperandrogenic system, the nervous system, is usually stress and anxiety. So if you get some support through a therapist or a behavioral counselor to just allow you to understand this type of condition with these symptoms, to help you understand that it's not necessarily you going crazy, it's actually just a response that your body is adjusting to. And sometimes our minds can catastrophize the whole event, and we feel like we're going to die, and that's not always healthy either, because you're not necessarily dying, it's just an imbalance. And the more you know, the more you're able to tackle. I have some people who go into disability because of these cases. So that's something what I help patients do, is overcome that, so it doesn't take away from their function and daily life. And then overall, once again, it's truly your lifestyle. These do make a difference. However, sometimes there are big needs for medications.
And potential treatments besides lifestyle management is medications and compressive stockings. So you want stockings that are compressive at 30 to 40 millimeters of mercury, and that can help keep the blood pool going. And also medications, cardiology medications, beta blockers are excellent. Midodrine, fludrocortisone is a medication that brings in salts into the body, but you want to be careful of your potassium intake. Sometimes patients have a lower potassium when they're on fludrocortisone. There's other ones like pyridostigmine that help with the parasympathetic nervous system, droxidopa, ivermectin, and methylphenidate. So these are all excellent medications. You can mix and match them. Please talk to your doctor about these medications if you suspect POTS. And here are references. And I hope you guys learned something about POTS. It's related to so many different issues, autoimmune issues. It's also related to mast activation, Ehlers-Danlos syndrome, and we deal all that in our clinic. So if you want to see us in our clinic, we're licensed in many different states in the U.S. I see patients all through the USA, and so does Dr. Melissa here. Please go to our website, drlifestyle.org, and we'll see you there.
Yeah, so it's so great being here. As I said, we are people who have not only been through different types of our own chronic diseases, but we love empowering people to know the meaning behind their symptoms. And next time, I think we're gonna do something different. I'm gonna be in the kitchen, Dr. Melissa's kitchen, gonna be showing you a great recipe that can help potentially your autoimmune diseases and empower you to try new ingredients and herbs. And so I'm happy if you want to leave your comments below, if you want any sneak peeks or just ideas, any questions, we're always happy to answer them. And as we talked about with FAJ before, last time we were doing yoga. Who knows what we're going to be doing the next weekend, but we love staying active, so enjoy your day.
Thank you.